Morning and welcome to our first family caregiving webinar of 2024. Happy New Year, everyone. Hope you are all having a good start to your new year. My name is Carrie McClellan. I'm the outreach manager for ElderHelp, and I oversee our family caregiver support program, which is where this webinar is hosted through. I will introduce our guest speaker in just a moment, Nellie Hernandez, but we're excited to have her here with us today. Before I do that, though, I wanted to just give you a brief overview about our organization and who we are and what we do to support the community. So at ElderHelp, we provide personalized services and information to help seniors remain independent and live with dignity in their own homes. We are celebrating our 50th anniversary, which we're really excited about, and you're welcome to see what all we're doing this year to celebrate that milestone. Check out our website at elderhelpofsandiego.org for more information. I will go through these briefly as far as our core services and how we support seniors directly. We offer our information and referral service to anybody who is looking for resources. That's a great way to get connected with what's available in the community. So we're always happy to answer questions about our programs and then also connect people to other community organizations that they might be interested in. We offer check-in calls through our Are You OK program. So that's really great for people who might live alone and could benefit from having those daily check-ins. We offer nutrition services through our food pantry as well as grocery shopping assistance. We offer transportation through our Seniors A Go-Go program, and that is a volunteer driving program. So volunteers help with transporting our clients to and from their appointments. We offer a variety of services through our care coordination program, much of which are provided by volunteers who would visit our clients on a regular basis to help with grocery shopping or friendly visits, minor home repairs, help to sort through mail and bills and that type of thing. We also have degreed social workers that help to assess our clients' needs and provide additional resources through that program. Our housing services team helps with navigating the housing resources available, as well as our home share program. So it's essentially a roommate matching service, as well as a new housing support fund that we offer. And then our family caregiver support program is where this webinar is through. And we not only offer webinars like this, but we also offer our information and referral service to family members who might be looking for resources to help their aging loved ones. We also have created online courses that are available at no cost. They can be accessed on our website. So feel free to check out our family caregiver page if you'd like more information about that. And we are very grateful for our partnership with Alzheimer's San Diego that offers a variety of services, and you'll learn about those today through Nellie's presentation. But today's topic is Dementia 101. And so we really wanted to start the year out by going back to the basics, looking at what's normal aging versus what's not normal, so that you can help to identify those beginning signs and symptoms of somebody in your life who might be experiencing changes, or perhaps yourself. So I am going to introduce our speaker for today, and we will go ahead and get started with that. So Nellie Hernandez joined Alzheimer's San Diego in 2021. Nellie provides education to individuals, families, and community members in English and in Spanish. She helps create a culturally relevant curriculum and deliver the classes in Spanish. Nellie holds a bachelor's degree in Child and Family Development from SDSU and a Master of Science in Counseling from the University of Phoenix. She has worked with families of various backgrounds for over 30 years in social services, education, and mental health fields. Her goal is to continue to use her culturally sensitive and inclusive approach to empower others. And she is a dementia educator with Alzheimer's San Diego. So Nellie, we're so grateful to have you joining us today, and we look forward to hearing all of what you're going to share with us today.
Yeah, thank you, Carrie. And thank you, everyone, for having me today. For those of you who are expecting my colleague Jean, well, she's not available in our office, but we're hoping that she will feel better soon and be returning. But it gave me the opportunity to come and share some wonderful information for you all. And like Carrie mentioned, right, to give us the opportunity to see if we've recognized that something has changed or if we're concerned about something where we need to start our planning and reaching out to a primary physician. So today we're going to be talking a little bit about what we consider Dementia 101. And let's see if we can get this to work and move forward here. Well, we're going to ask Carrie to help us out because it looks like we're having some technical difficulties. There we go. Today, specifically, we're going to be talking about not only Alzheimer's disease, but also us other related dementia. And we're going to look at the symptoms of dementia. What are the symptoms that we see or recognize changes, and what should we do about it? We're also going to briefly talk about some risk factors, some screening and diagnosis, and what you should consider if you are having a diagnosis or what you need to consider if you're in the process of getting a diagnosis. We'll look at the progression of the disease itself, and we'll also briefly look at some symptom management techniques that can be used or something that you can consider to discuss with your primary physician. Lastly, we'll look at planning, not only safety planning, because as the disease progresses, there are some concerns of safety that we want to keep in mind, but we'll also look at the overall well-being and how we can plan to make sure that we are taking the best care of ourselves as a care partner or the best care of ourselves if we are the person going through the changes with this disease. And lastly, we'll definitely look at the importance of creating a support system. Where can we go to get support and what should it really look like? And where can we start? Okay, let's get started first, though, with some terminology, because one thing that we do know for sure is that it can be tricky. We hear a lot of terminology out in our community, and sometimes leads us to feel a little more confused about what we're really needing to ask or how we're really needing to prepare to visit with our primary doctor. I want to start by telling you about mild cognitive impairment. Oftentimes, you may have heard it referred to MCI, and the full name was actually minor neurocognitive disorder. What MCI is referring to is this is when there is a memory or a cognitive change. However, that change does not interfere with the daily function of the person. Those changes, however, are more severe than the change would be as it is normally related to the age of the person. So it's still something that we can talk to our primary doctor about. It may look different than what you expect it to sound like when you talk to your doctor, but it is important for us to recognize that there can be some memory or cognitive change, although we're not seeing any interference in our daily life function. And we'll see the difference when we're talking about the daily life function interruptions here as we move ahead. Now, when we're talking about dementia itself, this is considered a major neurocognitive disorder. When we're talking about dementia, we're actually talking about a group of symptoms that are caused by an underlying medical condition. Now, here's the difference. This does cause impairments to either memory, language, visual perception, problem solving, and attention. Remember, it comparison to when I just spoke about MCI, I said that it does not interfere with daily function. When we're talking about dementia, we are seeing that these symptoms are interfering with daily function. And when we move on to talk to the most common type of dementia, we're going to talk about Alzheimer's disease. Alzheimer's disease is the most common type of dementia, and it's irreversible, and it's unfortunate that it is actually a progressive brain disorder. So now we've heard about MCI that doesn't interfere with daily function. We've heard about dementia that can interfere with daily function in different areas. And when we're talking about Alzheimer's disease, it's a specific type of dementia, which is the most common, Alzheimer's, and it's progressive. So instead of getting better, we know that the progression means that the symptoms are going to increase until the person reaches end of life. Now, when we typically hear about dementia, you might have thought, well, you know what, dementia only happens to an older person. That's not anything that we need to worry about. But here's the thing, that's not true. There is young onset type of dementia. What does that mean? That this form of dementia actually have symptoms that actually appear or can appear in someone as young as 30 years. So 30, 40, 50, 60 would be considered a young onset type of dementia. Okay. So that just makes it a little clearer for us to understand that dementia is not just for all of us that are aging. Let's move on to look at some treatable causes of cognitive changes. The reason we talk about this is because these causes that we're going to mention and go through here have symptoms that mimic and or can make us feel as if someone or even ourselves is possibly having signs of dementia. Now we're talking about treatable causes that interfere with the cognition, such as depression. Typically, when somebody's depressed, if you have recognized somebody with symptoms of depression, or you have gone through symptoms of depression yourself, you might recognize isolation, lack of motivation, maybe some confusion, maybe some disorientation, depending on who the person is going through the symptoms, right? We're talking about somebody that might be going through an illness or an infection or a medication reaction, because we know or maybe have experienced that someone going through an illness or an infection can sometimes also feel low energy, not really wanting to participate in extracurricular activities or going outside of their usual activities that they do. The same with the medical reaction that might happen with medication, right? If we over medicate, we also might feel disoriented. We also might feel really sleepy, groggy, just not having energy, not following our normal daily living activities of feeding ourselves or finding the right nutrition for ourselves. Or even if we have a medical reaction that interferes with another medication, right? We can also feel as if we're hallucinating or maybe delirious, or definitely a lot of confusion. And it may seem that we lack motivation, but it may just be that we are having two medications that don't go well together and they're causing our body not to function as it typically does. Same thing with inadequate sleep. If you've ever had a night where you get to the morning and you're saying, you know what, I just didn't rest. I feel like I'm foggy brained. I feel groggy. I really can't focus. I can't really seem to think of what I need to or the right word. These all are symptoms that sometimes can also be confused or that we see with someone going through some type of dementia. But we're talking about just being in a situation with inadequate sleep here. The same thing with stress. If we've ever been in a situation where we're stressed or have identified somebody in our life or around us that's going through some stress, we might see some of these symptoms that I just have mentioned with all these other treatable causes as well, right? You just really don't have energy, or you don't want to be around folks. Your lack of interest to try something or start something on your own might not be there the same if you're stressed out. You really can't focus as much as you used to. All these things that we usually see, all these symptoms that we usually see as treatable through stress, can sometimes mimic those that we see in dementia. The same when we're talking about sensory loss. We're talking about sensory loss, especially if we're talking about not even being able to distinguish between warm and cold, or not being able to really hear something the way we used to when we're going through hearing loss, perhaps. Even the fact that some of us wear glasses, even for myself, when we don't have our glasses on, when we can't really see the best without our glasses, there are certain things that we don't do the same or stay away from doing. And we definitely can see how it might put us at more risk for even such things as falls or tripping or having accidents, right? So, how does this look? These are things you want to talk to your doctor about because they are treatable conditions. That's why when we see some type of symptom that we might be concerned about or we're not sure about, it's best to still speak about it. If you don't have a primary doctor, speak to somebody around you or somebody that you can trust to help you get the resource that you need. We'll move on to talk to you about not only dementia, because we mentioned earlier when we were talking about the definitions of what these terms meant. Dementia is not a specific disease. It's an overarching umbrella term that is used, like I mentioned to you. Now, Alzheimer's disease, that is a specific type of dementia and a specific disease. There are other non-Alzheimer's types of dementia as well that you may have heard, or if you're like me, to be honest, there was some that I hadn't heard about, and some that I thought, well, what would that really look like? These non-Alzheimer's types of dementia that are commonly talked about, however, not all of us have heard about them, are Lewy body dementia, vascular cognitive impairment. And you think, well, vascular, what does that have to do with? Well, what I came to know myself and personally somebody in my life is vascular dementia is helped me to understand it by thinking about how a person that might have gone through strokes, right? This is caused because the vascular dementia may appear suddenly, right? And there may be memory loss and there might be confusion. And this is change caused by the blood supply that is no longer functioning or reaching the brain the way it should or the way it had. And so a stroke happens. So in turn, we see sometimes those individuals have been diagnosed or will be diagnosed with vascular cognitive impairment, which is a type of dementia. Frontotemporal disorders is also another type of dementia. And folks can actually have more than one type of dementia, which oftentimes they'll be told you have a mixed type of dementia. And imagine, although we already know that every individual has its own unique journey when they're going through symptoms of dementia, and it can look a little bit different and progress differently. But imagine when somebody has a mixed type of dementia, how much trickier it can be really to differentiate which dementia is bringing on what symptom, right? And there are many other types of dementia that we are not really going to go into today, but I'm going to encourage you to keep learning, and I'm going to encourage you to keep joining not only ElderHelp, but Alzheimer's San Diego and being educated as much as you can so you can not only help yourself, but those around our community as well, right? Because what we do know for sure is that between 60 and 80% of dementias are believed to be caused by the most common, which again, I'm reminding you, is the Alzheimer's type of dementia. Now, why do we talk about this? We don't see what goes on in our brain other than seeing the symptoms that we talk to our doctor about and start the progress of going through maybe searching for a diagnosis. What I want to share with you today is this image here, that the brain is affected by the dementia and that we don't see it on the outside per se. These are the things that can start changing in the brain that we won't ever see, but we know that this is what's happening. On the left side of the image, we see what normal brain tissue looks like. So typically our brain will look like this. You see a little bit more full. You see that there's really no dark spaces in there. In comparison to the image on the right side, where we see the Alzheimer's brain tissue. And what do we notice there? How does it look different? We see that it's smaller. The volume is reducing there. Not only that, we see all those open spaces in our image and all those dark spaces in our image, which indicates to all of us that there is no communication going on between neurons in those spaces. Those spaces of the brain have now died out. And when there is no communication in those areas going on, guess what? Those parts of the brain that communicated with the rest of the body are no longer functioning the way it was intended or the way it did before. So what does that mean? That it's going to start interfering with our daily life function, the way we do our activities, okay? So as the disease progresses, we now can take into account that as it progresses, these areas get bigger because there's less communication going on, and in turn, there's less that our body gets instructed to do and respond to. Now, this arrow points to where the extensive damage happens, which is in the hippocampus. And you might say, well, Nellie, why is that such a big deal that you're pointing that out? We point it out because this is the part of our brain where memories are not only created, but are stored. And what do we know about dementia? That eventually a person will not have access to the memories that are stored there. First, it will begin by the person not being able to store memories in there, which reminds us of why a person might not be able to remember what they had for breakfast. They can't store that new memory in there. However, they may still have access to the old memory, or they can tell you everything they used to do when they were in elementary school or when they started driving. Okay. At some point as this disease progresses, they too will not have access to that memory of where they went to elementary school and where they had their first driving experience. So there's a little bit of a difference there, but at some point as it progresses, again, I repeat, the person will not have access to storing new memories or those old memories that are already stored in there. Now, when we're talking about these symptoms, and you heard me mention there are things that we're all going to go through as normal parts of aging. So when we're talking about normal age-related changes, or are they symptoms of dementia? That is why if we do recognize a symptom, we want to talk to our doctor so they can give us assurance if it's normal part of aging, or maybe they can educate us on that's not normal part of aging, but this is something we can do or try because it seems like we need to either A, it's a treatable condition, or two, we need to look more into it and have some discussion about what possibly could be changing, okay? This is why we encourage everyone to know your baseline. If there's something that's different from your baseline, a marked change from your baseline, which is your normal way of being for you or any other individual, is important to know. So if you've never had a memory screening, that might be where you start. Get a memory screening. Know what your baseline is so that if you do recognize changes or somebody else points out a change to you that you may have not noticed, you can compare that change to what your normal baseline is, not only for you, but for all of us. It's helpful to know because we also want to take in consideration, is it significant enough to interfere with our daily activity? Remember I talked about something that's not going to interfere and something that possibly can interfere? we want to make sure that that change is not going to interfere. And if it is, we want to give it attention and see what we can do with planning for that change to come about. There are changes that can happen not only in memory, but in thinking and physical, and also if you see changes in behavior, right? Those are the four domains that often we see changes, and we want to be informed not only of the change, but again, how does that change look like against our normal baseline? And we're going to look a little bit more individually into what a normal change is versus what a symptom might be. Now, when we're talking about the domain of memory, we know that there are normal age-related memory changes, right? For all of us, it's going to be more difficult remembering names or finding words as we start aging. And we might even start misplacing objects more often. We know that that's typical as we age, but there are things that we can still do to help us remember it. It might take a little bit longer. We might ask somebody about something and they'll help us remember. We might still be able to use a technique to make memory reminders, such as a note or a calendar, or even our cell phone making reminders. We still have the ability to try other techniques to help us remind us of what is going on. It's very different when a person is going through a change that has to be that is or could be related to any type of dementia change or symptom. Because when that happens, a person is likely they may get lost in familiar places and just don't recognize how to get back, or can't check in with somebody to say, hey, how do I get back? They might not understand that language that's going in between them as well anymore. And they may even forget the function of objects, whether it be keys, whether it be glasses, whether it be a remote control. That ability to use a pencil, a pen, and create memory reminders, that ability is no longer there. And it can look very different because the person may not have the ability to use that object or know what the object is used for, including a cell phone, right? You heard me talk about, oh, you can still make a reminder on your cell phone for the alarm to go off. Person going through dementia changes and symptoms may not have that ability to use the cell phone because they don't remember, recognize the whole process of using the cell phone anymore like they once did. When we're talking about thinking, there are normal age-related changes in thinking that we all go through. We learn slower, we process information. It may take us a little bit longer to figure out how to solve a situation that we're going through, but again, we still have the ability to do it. And our attention span is much shorter, or it can seem much shorter, or it could take us a little more energy to focus to really learn something new. Our attention just takes a little bit more focus for us. But again, we still recognize that it's slower. We can still recognize that we can do it. It's very different when a person's possibly going through symptoms of dementia. There's new difficulties with language. You heard me say a person perhaps doesn't have the ability any longer to check in with somebody and carry a full conversation about, I need you to help me remember that I need to go to the doctor's appointment. That's a lot of thinking of what needs to happen to ask for help. That language is starting to change. There's new difficulties not only with language, but also reading, writing, and journaling or working with numbers as well. That's why oftentimes you'll see individuals going through symptoms will have problems or challenging paying their bills and keeping up with whatever their budget might be or their daily way of living with their finances might be. You'll see or recognize those changes. That change in judgment, insight, or even reasoning is no longer the same. So that solving of problems is a challenge now. You'll see that with that comes driving, cooking, and not only finances, but those two other tasks that I mentioned take different steps. And that steps of following the process of following steps and sequencing is no longer intact the way it used to be. And we're talking about physical changes. We're all going through changes as we age. If you're like me, you probably are going through changes where you may not feel as strong as you used to be. You're not feel as flexible as you used to be. You just don't move as fast as before. Maybe you don't dance like you used to before. Maybe your way of getting around or moving has changed, right? Because our muscles aren't the same. And overall, we just don't have the same flexibility. We may rely on glasses to see better. We may rely on hearing aids to hear a little bit better, a little bit sharper. This is all normal part of aging. When we see these changes happening, when we have to start including other things to help us be at our best of what that might be at that time. But when we're talking about changes that may be related to dementia symptoms, we're not just talking about the use of glasses to see better. We're talking about the visual spatial field that can be a full visual spatial field that continues to reduce and reduce and reduce as the disease can continue to progress till it's binocular and at some point, unfortunately, monocular. And if you try to do that right now in front of yourself, if you're able to, you can recognize that the more monocular the vision gets, that visual spatial field is smaller. Imagine all those things that we were relying on to help us get through the day that we no longer can see in our vision because our field is smaller. And we are only able to really see that monocular small vision that is right directly in front of us and probably needs to be at eye level because we know that as that shrinks, we are at more risk for falling. Our balance is different and our equilibrium overall is not the same, especially with all these physical changes happening, perhaps as the time goes on. So keep that in mind, how challenging it can be. And now we can really go back to visit and think about how it really affects our everyday of living and all the things we do throughout the day, not only caring for ourselves, but preparing our meals, right? If we can only see monocular, if we only see monocular, how would driving come into play? How would it affect that? How would it affect us going around to the places we need to go to? We see now, have a better understanding that physically it really does change things the way we do, or I should say, the way we do things, excuse me. Now, this might become a surprise to you because I definitely did feel a little surprised when I first started learning how dementia really affected behavior. Here's what you want to keep in mind. The way we are now with our personality or the way we seem to be very bubbly or conversational, or you just have an outgoing personality, you will be like that for the rest of your life because the changes in behavior are not normal part of aging. However, if you recognize changes in behavior, remember first you want to make sure it's not a treatable condition because some of the things that I talked about in treatable conditions is exactly what we don't want to see as a long-term change. You might see a person going through mood or personality changes that might seem different. You may see a person socially withdrawing, no longer really interested in doing anything of any sort or showing initiative to be around anyone. You might see that they may have difficulty starting new tasks, even if it was something they really enjoy doing, they may have no interest in it anymore. And overall, it may look so different that you may say, wow, this person is really changing the way in comparison to the way they used to live or the way they used to do things. And this is what we all want to be vigilant of. Typically, now you're typically not going to hear somebody say, you know what, boy, and forgive me if your name is John. Boy, John used to just be so grumpy. He didn't like to do anything. And all of a sudden, he just wants to talk to everything, to everyone. And boy, he just has so much great conversation and seems to, all of a sudden, he got a pep in his step and wants to try all these things. That too can be a serious change. But we don't often talk about that. I mean, who doesn't want to be around a happy, jolly person, somebody that has a great attitude? For the most part, we all do. But it's when we see it the other way around that we're a little concerned. But just keep in mind, either or, whichever way it goes, whether it feels good or not, this is a major change that we want to bring up as a type of behavior change. So we want to bring it up. And so you may be asking yourself, well, geez, it doesn't seem like Alzheimer's is, it's just one more disease. There's a lot of diseases that exist. But I want to share that the disease that we're talking about, Alzheimer's dementia, the most common type, has impacted not only me, but you, and will continue to impact all of us as we continue to go on. Already, 5.8 million Americans are living with Alzheimer's disease. So whether the person is in your house or not, it's granted we're going to meet somebody in our community that's living with Alzheimer's disease, and it affects 9 persons over the age of 65. And we know that as we all are living longer and our age is going up, the risk for dementia also goes up, because as we age, the risk goes higher. And already nearly 100,000 have been diagnosed just in San Diego County. And imagine how many of those individuals will never be diagnosed for whatever reason. They may choose not to, they may not be able to, whatever the reason may be. There's got to be more than 100,000 people living with it. We're only talking about the 100,000 that were actually diagnosed and reported, right? But we do know that it's very unfortunate that it will take a significant toll, and it has already, not only emotionally, physically, and definitely a financial toll on me, you, and all of us as the community of San Diego. Because we know that when we work together and live together as a community, we are affected by everything that's going on when it comes to Alzheimer's disease. Whether you're the care partner, whether you're just a community member out in the community, meeting somebody that has Alzheimer's disease, we want to make sure that we're able to know best how to be able to support that person living their best life, whether it be connecting them to somebody or a resource they might need, whether it be getting them to a primary doctor, whether it be sharing a social conversation with them so that they can continue to keep engaged with the world around them. Now let's talk a little bit about risk factors now that we have an idea of how we are all impacted by Alzheimer's. There are risk factors that we all should know about. Now, keep in mind these are risk factors. So later, we're going to briefly mention to you what we can keep in mind to reduce our risk factors. Some of us might feel that we're more at risk than others, but regardless, we all can benefit from knowing the risk factors. You heard me talk about age. As we all age, as we all hit 65 and older, our risk factor is going to continue to go up. If you're a female, you are more at risk. Does that mean a male is not at risk? No, a male is also at risk, but a female is more at risk. Females seem to be more at risk for having or developing or perhaps reporting having some type of dementia. We know that we encourage everyone to know what their health looks like, right? We talked about knowing your baseline, because one of the risk factors is hypertension. Oftentimes you hear people talk about it as high blood pressure, hypertension, any type of heart disease. Remember, we talked about vascular dementia and having strokes. We want to make sure that our brain is getting the blood flow that we need. Diabetes, somebody that might have hearing loss, right? We also talked about sensory and the importance of having sensory changes in our body. These are all risk factors. Genetics, you may already have somebody close to you in your family that may have gone through or is going through their journey of dementia. But it's also nice if you're able to learn about your family history. And I bring this up because not everybody is able to collect the information they need to about their family history and medical history, but you're going to do your best with the information that you have and try to start asking questions if you're able to, and keep track of those the information that you need so you can share it with your primary doctor, because that is also important. Now, when we're talking about education level, we're not necessarily saying that if you only went to a certain grade, you're more at risk. Education level, one is talking about it. They talk about education level because it can be measured, and we typically know what type of activities happen according to the level of education that you're in or getting. Now, we can argue that any kind of education, any kind of learning, where were you? How did it look like? How did your life look as you were developing, as you were growing, right? Because there's a lot of life activities that educate us in some way. How did that look? Because that was getting blood flow to our brain as we were developing and as we were aging as well. Now, when it comes to head trauma, don't just think some kind of accident out on the road. This could include a sporting accident at any age. It could include a work accident that may have happened. I know recently we heard somebody share with us, listen, my husband never thought about it, but actually my husband had a construction accident when he was in his early 30s that we really no longer talk about because now he's in his 70s. These are all things that can cause, or I should say, can cause the risk of dementia to increase, right? Because these are risks we're talking about, not necessarily causes that we're talking about. We're talking about the risk, causing the risk to go up. Now, think about it. Domestic violence can also be a risk factor if there's some kind of head trauma involved. And there's, if I didn't mention it already, a lot of sports events or sports activities can cause some kind of head trauma. Now, when we're talking about someone that may have Down syndrome, the person that has that extra chromosome is actually directly tied to making more of that protein that's tied to Alzheimer's disease. So you can see how that person that has Down syndrome will be more at risk. That doesn't mean that they are going to develop it. That means that they are more at risk to develop it and that they probably already have the biomarkers since they have Down syndrome. Now, we do know that there are ethnic disparities that are in the US, but there are no known environmental risk factors or causes that have really been pointed out to us. Or else we would be sharing them with you as well. Now, we talked about the risk factors, and I told you I will go over a few things that we may not think about, or a few things that we already are very well aware of that put us in control of lowering our risk factors. Because that's what I also have heard is, Nelly, you talk about all these risk factors. How do I make this stop? Well, there's no guarantee of anything that's going to make it stop, or else we would be talking about it. We're talking about ways that we can incorporate things and changes and create habits that will keep our risk lower or help lower our risk. And that's diet and nutrition, understanding what type of diet and nutrition really benefits our body so we can get the right nutrients in there, right? That doesn't mean to follow a specific diet. It's the way that we're going to give nutrition to our body and the way that we're going to try to eat in a healthier manner. Exercise and activity, we know how that's important. Why do you think it is? Remember, I talked about how important it is to get that blood flow to the brain. The more we move, The more we are physically moving around or participating in some kind of exercise or movement, the more it's going to pump our blood and the more brain activity we're going to encourage with that blood flow in our brain. Intellectual activities, we want to always challenge ourselves. Listen, I told some youth the other day, I know that seems frustrating, but it's frustrating because you don't know how to do it yet. But once you get in the hang of it, it's going to feel better. So we got to work through that frustration. While we're doing that, we got to remind ourselves it's giving blood flow to our brain. And social connections, we talked about getting out there when a person is socially withdrawn or they're isolating. We want to have conversations with each other. We need social connections with each other, whether it be by phone, whether it be in person, whether it be sharing a walk, a meal, sharing a game, whatever you need to do to be socially connected. Participating in webinars, what a great way to learn something, get your brain working and exercising, and connect socially, right? Because we get a chance to talk to each other, hear each other, share our thoughts or what we may be going through. And quality sleep, we talked a little about the importance of figuring out how to get your body rested, however that might look. Get a new bed hygiene started so you can follow the process and get your body in tune to resting when it needs to. Because remember that overall, we need to all remember that what's good for our heart is good for our brain because it helps our brain keep actively moving. We talked about those individuals that may never go get a diagnosis. We may that include ourselves in that. Maybe we haven't moved forward to talking to our primary doctor. But I want to share this with you. There is a value in getting regular screening, right? Because number one, it helps us to understand where we're at now, what is our baseline? Because if somebody recognizes symptoms, or if I recognize changes, we can compare that to our baseline. And detecting changes early is such a benefit, even though it may not feel good to hear it or recognize it, but it can help start planning. And it can also help us to rule out those conditions that are reversible and are causing us to have memory changes already or starting to make us feel that we need to be concerned about something else. So we always often hear us talk about we want everyone to get connected to a primary doctor. If you don't feel that you have somebody that you can confide in or a way to connect with a doctor or some kind of medical support, please check in with our organization and let them give you some guidance to where you might connect to somewhere and start your journey of better health and better maintaining your care, whether you're a care partner, whether you're a person living with memory loss, whether you're a person that's actually supporting and working for others to learn how to better support each other or learn about memory loss. Let's start with recognizing that sometimes we need to check in with each other and make sure that we have that primary care person in place so that we can start this conversation and just be more open about those things that we may not have felt comfortable talking about before, right? And just uh, rest assured that our organizations are here to hear you out and support you as best as possible because we want everybody to benefit from early detection and know how they can get an accurate diagnosis if this is something they are interested in. We want them to be aware of what is appropriate treatment and what is care planning. Does care planning mean just making an appointment to the doctor? Care planning could also mean preparing your questions. I didn't always know what to ask the doctor when I went there. I just felt that I should go there and say, this is what's going on. Well, now what? But you know what? We need to be able to ask questions sometimes. And sometimes it's helpful to get guidance to say, hey, well, what should I ask? And how should I better prepare? We want to talk about medication efficacy as well, right? Sometimes we don't really understand all with medication because there can be a lot to understand and try to differentiate what might be best for us and how do we go about it to get it. These are also topics that you can receive help from by contacting our organization. And continue to have guidance to connect with somebody or someone who might be able to help you for more advanced planning, right? Because you have time for this. These are not sometimes typical conversation that individuals and or families have to talk about advanced planning. So now you have a diagnosis. Now what do you do? It's not the end of the world. It's the time to start thinking about what else you can put in play, and also maybe consider taking the opportunity about learning about clinical trials, right? Because there's greater opportunity to participate in clinical trials, excuse me, when you are at an early detection, getting a diagnosis. So if you don't know what clinical trials are, you're not comfortable, or you're really not sure, or this is something that you want to talk to your family or friends about, um, check in with us so you can get some guidance on where you might be able to go for that, or how you might be able to learn a little bit more on how it might work out for you. When we're talking specifically about getting a diagnosis, you've heard me say that some people live without a diagnosis, and although there's 100,000 people that are diagnosed that we know about, when you're getting a diagnosis, I want you to be familiar with some terms. Yes, you're going to start with your primary doctor, but they're probably going to refer you to a specialist. And I like to share this because not all of us hear what they are, and you might think, oh my goodness, what kind of doctor is that? They may refer you to a neurologist. They may refer you to a geriatric psychiatrist. They may refer you to a neuropsychologist or a neuropsychiatrist, or they may just refer you to a geriatrician. They want to refer you so that you can take advantage of getting more specialized support and help by being able to go to them. So keep this in mind as well. And you can also expect that as part of the workup for that, it may include knowing more about your medical history. It may include understanding your physical well-being or where you're at or where your point of reference is, your reference baseline. It may include doing new lab work. It may include doing a neurological exam or just neurological psychological testing overall. It may include doing some brain images, and it also may include interviews with others. Now, how might this be helpful? Because I don't want anybody knowing about what I'm going through, but you may have heard me mention, as I spoke earlier, about having others recognize symptoms that you may not recognize. Sometimes it can be helpful if others around us share what they may have seen change, or how they may have recognized some type of symptom that we may not have recognized ourselves. So they may have a conversation with those around you or somebody you can consider close to you or that spends time with you, because it's always nice to collect as much as information as possible so they can move forward what might work best for the next step for you. So keep all of this in mind. Now, when we're talking about directly about the progression of the disease, here's where we're talking about it's not going to improve because there is no cure. Okay, we're talking about Alzheimer's disease. This progressive disease generally progresses at a slow rate. It has a steady decline of function over time. What does that mean? Well, we talked about that every individual's journey can look different, but over time, their abilities is going to change because the functions that they have are going to change. These symptoms and the severities are going to be difficult to predict at times, but what we do know is they can progress from 2 to 20 years, and it is very highly variable because it's different for everybody depending on when they actually got diagnosed, where are they in the disease. And what I want you to keep in mind is when a person or when we do get a diagnosis, it doesn't mean that we are incapable or that we're now incapacitated to do that we've done before. It does mean that we can expect there's going to be more changes and our functions are going to change. It can mean that we can expect that we're going to have to modify the way that we do things or do things differently or try things differently. But it doesn't mean that it's over, is what I'm getting to. Okay. Can it be scary? Yes, it can be scary, but that's why we say we're here to offer you support. Now, I'm going to go through some medication that exists. I want you to keep in mind that I am no expert or medical professional to know all the ins and outs about medication. These are the conversations that I highly encourage you to start having with a medical professional, your primary doctor, if you have not already. There are prescriptions that can be prescribed when somebody's going through or starting their journey of dementia. These medications are available, but they're available to help delay the progression of the cognitive symptoms in some people with dementia, not everybody. Right? We want to make sure we have these conversations again with a medical professional. There are cholinesterase inhibitors that you may have heard of. There's Aracip, Exelon, and Razidine that you may have heard of, or you may already be taking or have someone you know be taking. There are glutamine regulators as well. Namenda is the name you may have heard about. And there are those that take a combination medication, which is Namzamaric. Some people probably have heard it referred as memantine. Now, keep this in mind. These are the things that you want to talk to your doctor about because not medication might not be your choice or might not be right for everyone. So please keep this in mind, okay? Let's see what's going on here. We're having some technical difficulties. Thank you for bearing with us. Let's try this again and see if we can continue on. There we go. So there are new medications that you may have heard up until even earlier today on the news. I've heard some medications. I myself always say, again, I am not a medical expert. Please check in with your doctor or somebody that can help you connect with the doctor. These are the new medications that you are going to get in the PowerPoint that you will receive that you can use to benefit as you go to the doctor. Maybe you want to take it with you because you don't recognize or remember the names, right? There's ElderHelp, what's an FDA approved for mild dementia. And right now, what we have known at last is that it's limited to patients, or it was limited to patients in clinical trials. It tells us that how it would work is every 4 weeks, somebody would go in for an IV infusion. And it can have significant side effects, but it is covered by Medicare, but only if they're enrolled in some kind of approved study. Now, things may have changed because we don't always know the changes right away as well, just like you do. So let's check in with the doctors. That's the best thing for all of us to do. There's also lecanemab, which is already fully approved. And it also too is most effective for somebody in the mild stage. But remember, we may not know what stage we're in because we may just now be getting diagnosed and may already be in a different stage than we occasionally thought we were in, right? It also has an infusion every 2 weeks and it has side effects that are similar to Aduhelm as well. And it is also Medicare approved. Now, there are symptoms that impact the quality of life that can be managed, not only with adapting to the environment, but behavior as well, along with the medications, right? There is irritability, anxiety, worry, depression, or sadness. These are all symptoms that we've talked about already. Sleep changes, agitation, and restlessness may look different. They may increase, and there might be general emotional distress, as well. So these are the things we want to keep in mind as we ask questions, as we have somebody start taking the medication, because we want to make sure that we recognize what's changing, how it's affecting our person, so that we can talk to the doctor, okay? Now, things are going to look different. It's all about adapting to what's your new normal. That means that we got to learn how to communicate different. All of us, person going through the changes, person who's the care partner. Avoid arguing, avoid correcting, avoid confronting. Simplify things for yourself. Change your expectations so that you're not thinking everything's going to be the same. Things are not the same. We're all going to modify the way we do things to make it easier for all of us. Address not only what the person going through the changes and the journey looks like, but address the care partner's changes. What do they need? What will make it easier for finding that balance to this communication? Validate those experiences for everyone, those emotions that are changing, not only for the care partner, but for the person going through the journey. Adapt the environment to make sure that those risks are lowered, because the changes and the symptoms are making everything different. And redirect that attention to, instead of having that argument, if you're the care partner, there's some person that's helping or supporting the person going through memory change, there's no reason you need to keep reminding the person you're forgetting because you're going through this. That's because of this. Roll with the story that they're telling with you, change your expectation, and have the most fun you can with the best situation that you're in your journey, and enjoying that story that's changing. These are the safety considerations I want you to keep in mind as symptoms are progressing. I want you to challenge yourself to participate in our safety at home webinar that's actually coming on the 31st of this month, that goes into detail about how to set your environment up to reduce the risk, and how or what the details are that you need to consider when you're talking about fall prevention, avoiding injuries, not falling into abusive situation, driving. What do you need to do when somebody can no longer drive? What about firearms? How do you get safety locks? How do you manage your stress if you're the care partner? And wandering, I want everybody to learn about the Take Me Home program. Everybody with dementia will wander at some point. Don't wait till that happens. Prepare for your journey now. Living with dementia, it's physically, emotionally, and financially demanding. Remember, I said it takes a toll on all of us. So let's educate ourselves. Let's learn how to develop some skills to find that balance, and not only take care of yourself as a care partner, to take care of yourself if you're the person on the journey with some type of dementia, and how to better take care of each other as a community interacts and engage with each other. Just really building that strong network, how to find somebody to come in and help us get a break, get some respite. So important. It's not being selfish to tend to our own physical needs and mental health care needs as we go through this journey together. And maintain a sense of humor. You can laugh at the jokes that the person going on the journey is going through. You can laugh about the things that change that they may find funny as well. It's okay. This is a way we're all going to be able to go through and build our new normal. We know that it's never too early to start the conversation. Learn about advanced healthcare directives, whether it be through us or through your county website. Learn about your home and personal safety needs. Learn about driving if that's something that's your person's going to go through or has gone through. Prepare your finance planning. Get on one of our webinars about financial planning to learn more, because there's so much to learn. Engage with your support system to support you with your next step, whatever that might be. And overall, maintain your brain health, because even if you're not on this journey for you losing your memory loss, we all need to learn how to maintain our brain health and exercise our brain. It's helpful to all of us. Rest assured, there is so many places you can get more information. These websites are going to be sent to you, where you want to make sure you get information from credible websites that you can go back to at any time and feel supported to learn at your own speed whenever that might be, or to share with someone you know in the community that can benefit as well. These are all the free services that are available to you. I want you to keep in mind, if you're a person or you know a person that lives alone and going through some type of dementia or memory loss, please know that we have the Vitals program, which are trained volunteers that get in touch with that program to keep them socially connected, engaged to the world, and checking in on them. In case something changes that they don't recognize, they can connect them to the support that they need. These services are free to anyone in the county of San Diego by picking up the phone and connecting with us via on the phone or via website. So check in with us. I hope that you can join us on some of our social activities that are here in the office on Friday, or the outings out in the community, which are equally free. Don't feel that you have to do this on your own. It's difficult. We acknowledge that. We are here for you, and you're not the first one. And we're going to continue to support each other as best as we can. Okay? So hoping to hear from you all, and hopefully you learned something to take away from today that's going to help you and your community. All right, I think Carrie's got some info she wants to share with us.
Yes, and thank you so much, Nellie. That was such a good overview about everything. And I feel like you gave a lot of really great examples that can help people with the next steps and figure out how to plan ahead for their journey. So thank you for going through all of that important information. And it does look like we have some questions that came through, so I will go through those. There is a question about what exactly a memory screening is. This person shared that their mom has seen 2 neurologists and they have asked her questions, but she's curious, is that considered a screening or is it a more detailed test?
That is a great question. It is very likely that what you saw at the neurologist is a memory screening. They may have not used a paper to do it in the sense of they're having the form in front of them. But yes, those are the type of questions that you will typically hear or see as part of the memory screening. So it sounds like she may already have done one. But I want everyone to know that memory screenings can be done for free, contacting our office and scheduling. And if you're not able to get in with us, they will also guide you where you can get one also through Sharp for free as well. So keep that in mind. They know of other places in our community, and that's open for everyone, okay?
Wonderful, thank you. And then another question is about the diagnosis. Does a diagnosis of dementia or Alzheimer's open the door to help through Medicare or Medi-Cal?
I'm not an expert in the Medi-Cal and Medicare, but I will tell you that if you call to speak to one of our clinical care coaches here, which are probably more informed than I am, I just know the basics of it, they can actually work with you one-on-one to see where you're at. Not only for that, but they can actually give you the starting point for where you need to check in for Medi-Cal, and that will help you also determine and or decide if this is something you want to move forward with. What I will tell you is this. You want to make sure that you check in with it, because a lot of people don't think that they're eligible for Medi-Cal, but a lot of things have changed for Medi-Cal since it is based on whatever the person may have as far as finances are concerned. They'll be able to learn exactly where they fall into that category and see if there's something they can move forward to. But I'm never going to discourage you from applying. I'd rather us all apply and get turned down and understand why, because then we can actually look forward to another resource that can help you out with whatever you're seeking. Okay. So no, I don't want to say the diagnosis is going to make you an automatic. Yes. So apply either way, check in with our office, let somebody help you and give you guidance on that.
Wonderful, thank you. Another question came in about receiving a copy of the slides. And yes, as Nellie mentioned, you will receive a copy of all of the slides that were shared today. So I will send that in my follow-up email to you. The last question that I have at this time is that when a person with dementia has a memory lapse, what is the best way to gently remind them of the information they need?
It really has to do with what information you're really trying to remind them of. I'm going to invite you to come and take our communication class with us because it'll give you a better understanding of your response. And I think that's really what you're wanting to know. How to best respond at what time and what type of response should I use? Because it really depends on what they're asking, what they really need to know, what's going to prompt you to use what response, if that makes sense. In other words, if the person's saying something, we're not going to go forward and say, it's because you have dementia that you don't remember, or remember I told you, I mean, I know I have to tell you again because you don't remember. Those are the types of responses we want to stay away from. But we want you to still be able to respond and not seem like we're ignoring the person asking us multiple times. So I do want to invite you to that. That way you can bring it up and really see and explore what response would work for you according to the information that you really want to share or need to share, if that makes sense.
That's a great idea. And we have also hosted with your experts at Alzheimer's San Diego that class. And it is a recording is available on our website, but I think Nellie's suggestion of attending another class would be helpful so you can ask your specific question. But that is great. And then the only last question that came in was about how if you could share more about how the educational level is a risk factor.
Okay, let's take the word education out of it. Let's just use it and or replace the word learning. Okay. So let's try to imagine ourselves in life when we're at a younger age. Throughout life, our activities, we're learning some way or other. Whatever we're doing in life, that's how we're learning. And think about it. We're moving, we're making our heart flow, and in turn, we're making our brain get what we need, which is the blood flow, the energy, the storage of information, and we're having all those neurons just work and work and work and process, right? Okay. When we talk about education level, if you talk about education level, we'll just talk about San Diego to make it kind of easy for us. We're talking about education level. We can kind of picture when somebody's in kindergarten, we know what they're doing, or we have an idea of what they're doing. Now, when they go to first grade, we kind of have an idea of what they're doing too, or what they're learning, including their movement. Now, think about that all the way up to just high school. Now, we know in high school, well, obviously, we're probably not moving as much. We don't get recess, we don't get naps. So your activity and your learning and everything, it looks different, right? So it's measurable in that sense because we can relate to your education level as being measurable according to what age and level or grade you're in. Now, in life, when we're talking about it, maybe didn't I go to formal education, but yet I can picture what it might have been like as I was growing up. And guess what? If you were going in a 10th grade formal education, that's great and wonderful. We can imagine what it was like. But I can also tell you, if you and I were the same age and I should have been in formal 10th grade, I can still tell you all these things that I have done in my life or doing in my life that might be comparable to what you did or might even be more than you did, right? So I'm still learning, but it's not formal and it's maybe not be measurable like that. But you can still see I still got all the exercise in my brain and I still stored all this information. I still had all these neurons shooting off. The opposite said we can be the same age, and I was like, yeah, I didn't really do that much activity. That's why I like to explain it as formal education. Yes, it's education level, it's measurable, versus if you're talking about not formal, it doesn't mean that you can't have as much activity. It just says that it's really not measurable. So I might be from another country where there is no formal education and have as much movement as you did in 10th grade here. So that's kind of how I like to share with everyone. Hopefully that helps you understand it.
Yeah, I think that makes a lot of sense. Thank you, Nellie. And then as I just close out, so I wanted to share again, I know Nellie mentioned that one of the programs through Alzheimer's San Diego is their Vitals program, Volunteers in Touch. And so just a reminder, if you know anybody who lives alone that might be starting to show those beginning signs and symptoms of dementia, this could be a really great program to help them receive additional support so that they can continue living safely at home. ElderHelp is also partnering with this program and with Alzheimer's San Diego to recruit volunteers to help with additional services like grocery shopping and rides and home safety projects. So that's something that we're working together on, which is really wonderful. And then I will be coordinating and setting up other webinars throughout the spring. So definitely stay tuned for our upcoming schedule. But as I mentioned before, you can always check out our recorded webinar library that is on our family caregiver page of ElderHelp's website. And you can find the webinar library. All of the previously recorded topics are available for you there. So I know that that might be helpful for you if you wanted to check out those topics. And I will leave it on this slide that has our ElderHelp general contact information. If you have any questions, just in general, our phone number is on there, or you can send us an email. If you have any specific questions for me, my email address is there as well as our website. So feel free to take that information down, and it will be also in the follow-up email that I send out to you. And then Nellie, a question came in about the communication skills class, if it will be held in person only, or if it will also be available online.
You know, that is a great question. I think we all actually have one coming up on the 23rd of January. And I think that's here in person in our office. I think it's Maintain Your Brain Health that we have one online and one in person this time around.
Okay.
But I don't want you to be discouraged. Check in with us because that's one that typically we hold online, or we can have somebody notify you when the next one is closest to you so you can get in on it as well.
Wonderful. Well, thank you so much for all of that information and for fielding those questions. I think that really sets people up for the next step. And I will be sure to include the contact information for Alzheimer's San Diego so you can reach out to their team directly if you have specific questions about your situation as well. So I will be sure to send that out. And if you have any questions for us, you can respond to that email, and I'm happy to coordinate that and set you up with the right person. But thank you all for joining today, and thank you again, Nellie, for taking the time to share your expertise. And I hope everybody has a wonderful rest of their day.